Welcome to Treatments and Injectables 101. I've been seeing a lot of the baby girls talking about polynucleotides, biostimulators, Botox, filler, and I fear that you're getting a little bit mixed up. So I'm going to break it down, simplify it, and actually tell the difference between these things. I'm going to be giving you a deep dive on the most popular treatments, the fundamentals, how they work, how they don't work, and where you should be putting them in your face. And also, I'm going to be touching on the potential side effects. Unfortunately, what I've noticed is that there's a lot of information online, and I can see that the girls are getting overwhelmed and they're getting confused. They're getting their knickers in a twist. But before we get into it, in case you're new here, my name is Dr. Ewoma. I'm a medical and cosmetic doctor with over 10 years worth of experience. In other words, this is my bread and butter. This is what I do day to day. And as you can see, I practice what I preach. Let's get into it. Actually, one more thing, quick disclaimer, because I can already hear the internet birds singing. I am not advocating for anyone to get these treatments. If you want them, fantastic. If you don't, also fantastic. Okay? What a lot of people don't understand is whether I talk about it or not, the girls and the boys are going to be getting these treatments. They sell themselves, so I don't really need to say anything. But I just thought I'd give you a quick disclaimer. To make things really simple, I'm going to introduce you to the treatment pyramid. At the foundation of the pyramid is your skincare. Yes, all the things that you're doing at home. Don't forget that. And then on top of that, we have skin treatments and then injectables. And then right at the top, we have surgery. Again, it's not by force, baby. I'm just keeping things simple for you. And what I want to emphasize about the treatment pyramid is that you should start at the bottom. Why? Because it's the cheapest, least intensive, and least invasive. And then once you've satisfied that, slowly make your way up to the top. You may not have to go to the top, but you move in the upward direction of the treatment pyramid. Because as we move up, it gets more intense, it gets more invasive, and a lot more risky too. Okay, let's start at step 1 of the pyramid, at skin treatments. And in super simplistic terms, skin treatments manipulate the skin in order to address things like fine lines, pores, wrinkles, redness, pigmentation, the list goes on. Basically anything on the surface of the skin, this is where skin treatments come in handy. And examples of skin treatments include chemical peels, lasers, and energy-based treatments such as radiofrequency. One thing I want to preface when I say skin treatments is that by and large, these treatments address the layers of the skin. However, some of the treatments I'm going to mention within this section also go a little bit deeper. One common mistake that I've seen very frequently over the years is that people want to go straight to Botox, straight to filler. Baby, we need to start at the skin treatments. There's a reason that this is the widest part of the pyramid. We need to focus here because there's no point addressing those wrinkles with Botox or filling out volume on the face with filler if the skin is not looking cute. The skin needs to be addressed first, because actually, if you address the skin first, you might find that actually you don't need Botox, you don't need filler. So very, very important that you start at this step. In terms of the specific mechanisms that skin treatments use, I like to divide them into 2. Number 1, mechanical interventions, and then number 2, energy-based interventions. I love a good chemical peel. I love it, I'm obsessed with it, and I implement it within my skincare protocol. Yes, it's a protocol every quarter. That is how much I love it. I personally prefer a medium depth chemical peel, but we'll get into the different types in this next section. What actually is a chemical peel? Essentially, it's an acid that dissolves the top layers of skin, revealing brighter, glowier, dewier, gorgeous skin. It's honestly my favorite. I love a good medium depth chemical peel every quarter. I swear by it. In terms of the acid used, common ones include glycolic acid, salicylic acid, TCA, Jedners, lactic acid. The list really goes on. And as you can imagine, different brands within the chemical peel space have their own specific special cocktail of all of these acids in accordance with the specific skin concern that it's trying to treat. Okay, so what are they great for? They're great for everything from hyperpigmentation, texture, dullness, and congestion. Okay, so what does it feel like? It very much depends on the strength and the pH of the chemical peel used. Some peels, you literally don't feel them at all. At best, maybe like a mild tingling sensation. And then for the more stronger chemical peels, it's gonna burn real bad. Like, it feels like your face is on fire. But not all peels are like that. Not all peels, okay? That's at the extreme end. Don't worry. By and large, when it comes to chemical peels, you need to do a course of them, whether it be 3, 6, or more. Again, it really does depend on the brand that is being used. But 3 is kind of like a good average. in most cases. So in other words, unless it's a very strong chemical peel, do not expect sensational results in one session. That's not going to happen, okay? Don't ask them for a refund. You just need to be patient. Okay, let's discuss the side effects. Again, if the treatment is being done by a qualified professional and patient selection has been done, aka not all patients should be getting all treatments, it very much is on a case-by-case basis. If all of those things have been satisfied, your chance of a side effect is quite minimal, generally speaking. But if you find yourself in this unlucky situation, common side effects include redness, flakiness, and at worst, hypo and hyperpigmentation. Cough, cough, the chemical peels that you babes are getting online, don't do it. Chemical peels should only be done in a clinical space at a medi-spa by a qualified professional. Do not do it, honey. Do not do it. The saxophones will be very, very loud, okay? I've warned you. Time to discuss microneedling. And this is another one of my holy grail treatments. I love it. I'm obsessed with it. But on really simplistic terms, what is microneedling? So with microneedling, you're essentially traumatizing the skin in a very controlled way. I know that sounds horrific, but as I said, it's controlled, it's intentional, and in the long term, it's going to benefit your skin. And what is the main way that it's going to benefit your skin? It's going to induce collagen production. We love collagen. That keeps the skin nice and young and juicy and plump. Collagen is literally a part of the scaffolding of the skin. I absolutely love microneedling for enlarged pores, acne scars, and just overall skin rejuvenation and glow. In itself, is it going to help with pigmentation? No, that is a very common misconception. In itself, it will not improve hyperpigmentation. However, if you combine it with a serum, absolutely. Then you can see some of the benefits of lifting that pigment away from the skin. But in itself, it does not. Again, this is a treatment that you need to do a couple of times in order to see the real results. I personally get mine done like every month when I get my monthly facial, and it's something that I swear by. Pores where, I mean, nowhere to be found. In terms of the common side effects that you'll see with microneedling, they include redness, sometimes swelling, itchiness, burning. I know, it's so much fun, isn't it? Again, hyperpigmentation, worst case scenario, and more scarring. I know. Again, it's all about technique, baby. If you go to the right place, that's not going to happen. And microneedling is another one that you baby girls like to do at home. By and large, I don't advocate for it. I don't like it. I love you, baby, but I don't trust you. You're going to do it wrong. You're not going to be disinfecting it. And you're going to make your skin worse. So again, just go to medi-spa, just go to a skin clinic. One thing that I want to add to the microneedling conversation are exosomes. I feel like exosomes are everywhere right now, but what are they? One way that I love to explain exosomes are that they are essentially a DoorDash for your skin. Yes, an Uber Eats for your skin. In other words, they are tiny packages that can be introduced into the skin to send specific signals that are going to make your skin better. And literally better in every sense of the word. And at the time of filming this video, injected exosomes are not approved in the UK and the US. I repeat, they are not approved in the UK and the US. So if your baby girl around the corner, around the block, up the road is offering to inject exosomes into your skin, into your face, red flag, red flag. And the reason I wanted to talk about this after microneedling is because exosomes and microneedling are a match made in heaven. Combining the two treatments together will literally take microneedling to a whole nother level. I've done this many a times and I've seen such a significant improvement to the result I get alone with microneedling. And exosomes are going to be a perfect thing to introduce into your protocol for just general skin rejuvenation or if you're trying to address a specific problem. Okay, let's move on to energy-based treatments. I feel like when I say energy-based treatments, people think I'm speaking about something woohoo, energetic, aura. No, I'm not. It's just a really easy way of encompassing all of these amazing treatments that come under the energy-based umbrella. But what actually is laser? Laser is essentially focused light tuned to be absorbed by one target. One of these three targets. What are the three targets? Number 1, water, 2, pigment, and 3, blood. And when I say blood, I mean vessels, like redness. We're not getting gory here, okay? Anyway, I'll explain next. And one thing I really have to clarify is that IPL technically isn't a laser. I know, quite confusing, because often people use IPL and laser very interchangeably. However, IPL is not a laser. It's a very broad spectrum of light. Let's start with resurfacing lasers. Essentially, a resurfacing laser injures the top few layers of skin, revealing brighter, gorgeous, more collagen-filled skin. And as you may have noticed, that sounds incredibly similar to microneedling. And it is. But again, the weapon of choice is completely different. But the essence of it is essentially the same. Popular resurfacing lasers include Clear and Brilliant, Moxie Laser, and Fraxel. Fraxel's a real bad boy. Very intense, like 1 to 2 weeks downtime intense. But it gives you the best results. With the resurfacing lasers, you need numbing cream. I know some of the clinics out there are trying to do, especially Clear and Brilliant, without numbing cream. No, beg for numbing cream because it's quite spicy. I won't lie. It's quite spicy. It's more spicier than chemical peels. And if you're flirting with the extreme end of resurfacing lasers, you're going to need more than numbing cream, i.e. gas and air, and then some. In terms of side effects, you might get prolonged redness, swelling, dark marks, hyper or hypopigmentation, especially in deeper skin tones. And if you're really unlucky, it might activate a cold sore. Not fun. Let's talk about lasers that address pigment and redness specifically. These kinds of lasers are going to be your go-to if you want to address things like sunspots, post-inflammatory hyperpigmentation, redness, rosacea, and thread veins. And common examples of these types of lasers include PicoSure, which is a pigment-focused laser. And if you want to address redness and veins, look out for BBL and Lumecca. What do these types of lasers feel like? Well, I've only had Pico, and it was spicy. It was very spicy. Not the worst, but it was a bit spicy. The only way that I can describe it is that it's a cross between heat and like an elastic band sort of flicking at your skin. Heat and elastic band flicking comes together. That is how it feels. Make of that what you will. When it comes to pigment and redness focused lasers, it's very, very, very important that you get the diagnosis right. What do I mean by that? Certain lasers can make melasma worse. Okay, so it's very important that your skin professional can differentiate the difference between melasma and post-inflammatory hyperpigmentation. Again, this is all a part of the patient selection thing that I was mentioning earlier on. I hate to break it to you, but not all treatments are for everyone, unfortunately, because if they were, yeah, let's not even go there. In terms of potential side effects, you can expect blistering, crusting, hyperpigmentation, and even worsening melasma. And of course, temporary redness and potential swelling. Okay, let's move on to what I call skin tightening treatments, specifically radiofrequency and ultrasound therapy. What these treatments essentially do is that they heat the deeper layers to cause collagen contraction and production. So it's with these treatments in particular that you can get a non-surgical facelift. Again, it's not the same as an actual facelift, but a non-surgical one. Common types of ultrasound therapy include Ulthera and Softwave. And then common types of radiofrequency include thermage, Potenza, which also adds on microneedling. Yeah, you're getting two for the price of one for that. And Vivace. These treatments are going to be perfect if you start to notice a little drooping on the face. Okay, what do these treatments typically feel like? In terms of the ultrasound therapies, I would say these are much more bearable. Kind of feels like a little bit of heat and also that sort of flicking elastic band sensation. And then when it comes to radiofrequency, it's hot. It's hot. When I had thermage and I was awake for that, it felt like a mild hot iron being stamped many a times across my face. Again, I had numbing cream, but still I could feel the gist of it. So in terms of results, it's a little bit of a slow burner, but you'll start to see improvements from 3 to 6 months and beyond. And one thing I really want to stress is that these are not treatments that you're getting every single month. No, that is when you can start having nasty side effects. Really, you should be doing these kind of treatments like once or even twice a year, max. And one more thing I really want to preface when it comes to radiofrequency, if you think that you are going to get surgery on your face, i.e. a facelift, in the near future, it's really important that you seek the advice of a surgeon first, because my surgical colleagues, they don't like a face that has been touched by radiofrequency. It makes their life so much harder. So speak to a surgeon first before you start dabbling in these things. So in terms of potential side effects, they include swelling, tenderness, temporary numbness, and tingling. A worst case scenario, a fat loss. And this is particularly going to happen if you're the wrong candidate for this treatment and improper technique. AKA the practitioner was doing it all wrong, was just freewheeling on your face. There is a method to this madness. And it's the method that is going to stop you from getting these side effects. Time to move on to the next step, injectables. I do love a good injectable or two. Can you tell? I can't frown. Okay, let's get into what I call injectable light. What is that? Skin boosters. I do love skin boosters. I swear by skin boosters. So let me tell you why I love it so much. In very simple terms, skin boosters are essentially injections made out of very runny hyaluronic acid. And then they're introduced into the skin through injections. And these injections are specifically introduced into the skin, not deeper, very superficial within the skin. And really with skin boosters, the main benefit is going to be hydration. Like insane next level hydration into the skin, more than what any other serum can give you. And so with that in mind, this is going to be perfect for those of you with dull, thin, crepey, dehydrated skin. Yes, you can put them on the face, but even you can put them on the hands too, and the neck. The most common way that skin boosters are introduced into the skin is via several tiny injections across the face / across the area that you're trying to treat. But sometimes your clinician or practitioner might use a cannula, which is essentially a blunt needle. And so that way you're not poking at the skin multiple times. In other words, it's a lot more comfortable. Just like many of the other treatments I've discussed today, skin boosters need to be done as a part of a course. But what are some of the common side effects that you might see with skin boosters? This first one is very much a common / expected side effect. You're going to get visible bumps on the skin, but don't worry, they typically fade away within a few hours. But also, you're probably going to get a bit of bruising. How much you bruise just depends on the person, baby. Okay, onto polynucleotides. One of my favorites, obsessed, love her, love it. Give it to me, love polynucleotides. But what are polynucleotides? Simply put, polynucleotides are purified fragments of DNA, and they're typically derived from salmon, but there are other sources of polynucleotides too. Don't worry, honey, you're not going to turn into a fish, okay? And these DNA fragments essentially signal your skin to repair itself. Common polynucleotides include Planest, Amila, and my personal favorite, Regerin. Regerin is amazing, sensational, divine, love it, love everything about it. And it's probably the most common / most popular polynucleotide in Korea right now. Let's talk about botulinum toxin, aka Botox. By the way, Botox is a brand, so I don't want them to come after me, okay? But I just know everyone calls it Botox, but it's technically botulinum toxin. So just to provide a little bit of context, Botox has a whole host of different uses and benefits. But in terms of facial rejuvenation, it's especially used to help address fine lines and wrinkles, and just some of the muscles in the face in general. But for facial rejuvenation, the typical target is muscle. But what actually is botulinum toxin? Essentially, it's a purified protein that blocks the signal from the nerve to the muscle. And so that way the muscle stops pulling and hence the line stops forming. Lines being fine lines and wrinkles. So what are the common brand names of botulinum toxin? Well, everyone knows Botox. Botox is that girl, that OG, that baddie. But also you have other brands like Azulor, Bocaccio, Illusions, and Dysport. And not to make things any more confusing, but there are actually short-acting and long-acting botulinum toxins. What do I mean by that? Short-acting meaning that they last between 3 to 6 months, and then long-acting meaning that they last 6 months plus. And if you're in doubt about which one to pick, just have a chat with your practitioner. What does Botox actually feel like? By and large, darling, it's really not that bad. To the point, you don't really need numbing cream. If you're a bit of a baby, like me, I'm sometimes a bit of a baby, cool. A bit of numbing cream goes a long way, but it's literally the equivalent of getting your eyebrow threaded at best / at worst. And essentially, it's just a series of pinpricks in the target area, and that's it. It literally takes a couple of minutes, if even that. And with Botox, it's very normal to experience redness, bumps, but all of that goes away after a couple of hours. You don't need to worry. And then in terms of the results, again, it depends on the product, but by and large, you start to notice a difference in a couple of days. And then the peak results are at 2 weeks. So in other words, baby, we need to be very patient and wait up to 2 weeks before we give the final verdict on our Botox appointment. Side effects include bruising, droopy lids, just droopiness, basically the opposite effect of what you're trying to treat. And last of all, Botox flu. Google it. There's actually Botox flu, botulinum flu. I think a common misunderstanding about Botox is that it will freeze your face. Baby, it doesn't have to freeze your face. It's all about the amount and the quantities that you inject into the face. If you want that face to be frozen, then yes, you're going to be needing a lot of Botox. But if you just want a sort of baby Botox, natural sprinkles, you still want to be able to move your face, you can absolutely have that. It's all about the technique of the practitioner. I don't really want to get into the whole preventative, non-preventative debate when it comes to Botox. My personal opinion is that we need to be starting a little bit earlier than what we think. We need to be starting a little bit earlier before those lines finalize in our face, because at that point, it's kind of too late. Let's talk about injectables that address a volume to the face, or lack of. And the most popular kind is dermal filler. But what is dermal filler? Essentially, it's a hyaluronic acid-based gel used to add projection, volume, and structure to the face, that is. And the two most popular filler brands that you've probably heard of are Juvederm and Restylane. Dermal filler is going to be perfect for those of you that want to address genuine hollowing to the face, or even you just want to add a little bit of volume to places that aren't necessarily hollow, aka the lips, just making them a little bit more juicier. But also in terms of the structural benefits of filler, you can also use it to contour the face, i.e. through nose filler, cheekbone filler, etc. Is dermal filler actually painful? By and large, no, especially if you're using numbing cream. And also a lot of the dermal fillers are actually mixed in with a local numbing agent. So literally, the more that you inject, the less you're gonna feel. And the numbness feels quite deep down, which feels really, really weird. I can only kind of liken it to like when you're at the dentist and you get that sort of weird heaviness, but in your face. In terms of how long filler lasts, it really depends on the brand and the product used. But by and large, we're looking at between 6 to 18 months. However, recent evidence is showing us that where you're especially getting repeated sessions of filler, it may last a lot longer, i.e. years. And so this is why I say do not get trigger happy with dermal filler. A little bit goes a long way. Baby, it's a marathon, not a sprint. By and large, there's no reason for you to be injecting 10 mil of filler into your face in one session. No, you're gonna look scary. You're gonna get that pillow face. A little bit goes a long way. And the really unique thing about hyaluronic acid-based dermal fillers is that they can be reversed. In terms of some of the side effects that you can get with dermal filler, they include swelling, bruising, lumps and bumps, and asymmetry. And if you're really unlucky, it can lead to vascular necrosis. Yeah, you don't want that. Let's just say you don't want that, because if it's not treated on time, the effects are permanent. Feel free to Google what vascular occlusion looks like. We are coming to the end of the injectable section, and I'm going to finish on biostimulators. I feel like biostimulators are very much in trend, in vogue right now. Everyone's talking about them, but what are they? Baby, I need to set the record straight. Biostimulators are not dermal fillers. I repeat, biostimulators are not dermal fillers, okay? They work quite differently. Essentially, they are injections that stimulate collagen production within the deeper layers of skin. And through that, they give a very natural, gradual volume improvement, aka they improve the hollows of the face very gradually, very subtly. Because dermal fillers have that instant volumizing effect, but biostimulators do not. It's a slow burner. Common biostimulators include Sculptra and Radiesse. As I mentioned, biostimulators are best for volume loss, but they can also improve the quality of the skin. The collagen-inducing process builds over about 3 to 6 months, and then results can last between 1 to 2 years. Okay, what are some of the side effects that you can get with biostimulators? Unlike dermal fillers, they are not reversible. There is not an antidote. There isn't an antidote to it. So beware. Again, this needs to be done in very qualified, experienced hands. Common side effects include lumps and nodules, hence why your practitioner will often tell you to massage the area post-treatment. You can also get bruising and swelling, which is of course super common, but also overcorrection that you can't reverse. Baby, well done for making it to the end. Well done. You are a diligent, attentive student, and I'm proud of you. Let's talk surgery. But before I begin, I want to stress something again. I'm not forcing you to go get surgery, okay? I am not. So don't say I am not. I am simply educating you. And because surgery is the most invasive of them all, you need to be very careful. You need to be very careful. You need to do your research, and the side effects can be deadly, quite literally. And so because of that, I do not want you scrimping on your surgery. That's not to say that you can't go abroad to do your surgery, but you need to go to a reputable place where the surgeons are highly qualified and experienced, okay? But personally for me, I would prefer to just stay in my home country to get surgery. Again, that's not a hard and fast rule, just my personal preference. And the reason for that is that it's just easier. I know the lay of the land, I know the law of the land. And in terms of potential follow-up, it's super easy. You just go down the road. Unlike if your surgeon was halfway across the world, you're gonna jump on a plane? Yeah, not as convenient. But again, this is very much a personal preference. Fundamentally, just go to someone who knows what they're doing. That is all I care about. And you're probably wondering, why am I even mentioning surgery? Well, there comes a point where no matter how many skin treatments you do, no matter how many injectables that you do, you're not going to get the desired result. You're just not. And so this is where surgery comes into play. Like, for example, a common concern that people come to me with is sort of fullness, puffiness to the under eye area. When that's coming through the door, baby, you just need a blepharoplasty, okay? Filler's only going to make it worse. And everything else is me just trying to make money, okay? You just need to go get surgery. And that's only if you actually want to address the problem properly. If you don't, you can leave be. If you don't, you can go get polynucleotides. But are those things going to address the puffiness to your under eye? No, they are not. It really depends on you, and you just need to be clear in your mind how far you want to take it. Because as I said, these things come with risks. Okay, let's get into some of the risks. Bleeding, infection, complications of varying degrees. Too long for me to list. And last of all, death. Yeah, babe, it's that serious, death. And so with that in mind, no black market BBLs. The baby boy doing BBLs around the corner in his kitchen? No, because these side effects that I've mentioned will become a reality. Okay, darling, well done for making it to the end. I hope that has clarified a lot of the confusion that you may have been experiencing when it comes to the world of skin treatments and injectables. If not, I'm so sorry, but also you can ask me questions down below in the comments and I'll get back to you. Oh, and one more thing before I go, in case you missed it, I have just released my new guide called Fundamentals. And in this guide, I break down all things skin treatments, skin routines, skin products, and even my own skincare routine. And so if you want to buy it, the link's down below.